welcome to the Hawaii Health Data Warehouse's Coffee Break monthly webinar series. I'm Julia Chosey, a public health epidemiologist with the Hawaii Health Data Warehouse, or HHDW. Today, we're going to be exploring the latest death record data collected as part of the National Vital Statistics System. First, a little history. There are records of birth and death data collection all the way back to the start of the United States. However, it took some time to build an official system for collecting vital statistics. Here are a few milestones in that process. In 1902, the Census Bureau was authorized to obtain death data for the residents of the country. The National Birth Registration System was established in 1915, and by 1933, all states were registering live births and deaths. In 1960, the National Center for Health Statistics was established to oversee the National Vital Statistics System, and this is now part of the Centers for Disease Control and Prevention. In Hawaii, death records are managed by the Office of Health Status Monitoring in the Hawaii State Department of Health. Death record data is extracted from death certificates, which are completed for each death in the state. Information is collected about the decedent as well as the death, including date, location, and causes of death. The causes of death are determined by a physician, advanced practice registered nurse, medical examiner, or coroner. And these causes are coded according to the International Classification of Diseases 10th revision, or ICD-10, as we call them. This allows for comparison of causes of death across different geographies, standardizes the system that we use. So, although multiple causes of death can be coded, a single cause of death, known as the underlying cause of death, is identified. And this is defined by the World Health Organization as the disease or injury which initiated the train of events leading directly to death, or the circumstances of the accident or violence which produced the fatal injury. And you'll note that our system in HHDW is built around the underlying cause of death. HHDW houses death record data for the state from 2000 to 2023. And the CDC has established criteria for reporting death data, and we follow those guidelines. Specifically, cells with counts between 1 and 9 are suppressed for confidentiality, and rates based on cells with counts of less than 20 are suppressed for statistical reliability. If you're interested in obtaining record level data for the state, we can help you through this process. I'll show you where to go when we do the website demo. As we'll see, there are 3 types of death queries available in HHDW. First, there are counts. Second, there are population rates. And third, there are population rates by Department of Health, race, and ethnicity. And we'll discuss the differences between these now. So starting with death counts, you can query counts or numbers of death by a variety of dimensions we'll review. The first thing to establish is the cause of death. In HHDW, there are 5 options for choosing the cause of death. The first is death from all causes, and the next 3 are grouped causes of death from the National Center for Health Statistics. And then the last option is to enter in your specific ICD-10 codes that identify your cause of death of interest. Taking a closer look at those National Center for Health Statistics causes of death, you'll find a list of causes of death from which you can select one or more options. The NCHS leading causes of death include the top 51 causes of death, while the list of 39 or 113 offer a selection of options from which you can choose one or more. For the counts query, you can look at the data by a variety of dimensions. For geography, you can choose the location of the death or the residence of the decedent. For the location of death, counts are available at the state, county, and island level. More detailed geography is available when looking at the residence of the decedent down to the primary care service area. These more granular categorizations will include deaths for Hawaii residents only. Of course, you can also query the data by year, both individual years and custom aggregates of years. And you can explore death counts by characteristics of the decedent, including age, sex, race, ethnicity, marital status, education level, and military status. HHDW provides 2 different death rate measures for the population and the population by DOH race ethnicity. The first is the crude death rate. This will be the number of deaths per 100,000 population. If you wanted to see the death rate for a specific age group, this is the rate you would use. The second option is the age-adjusted death rate. This controls for differences in the age distribution within a population to allow for better comparisons across geographic areas or race ethnicity. And the rates are age-adjusted using the 2000 US standard population. We'll look at the difference between population rates and population rates by DOH race and ethnicity in a minute. In HHDW, death rate data can be explored by geography, year, and age or sex of the decedents. These dimensions are more limited than the death counts because they require estimates of the population size and composition. There are some things to remember when exploring death rates in HHDW. First, the numerator includes death among residents only. Visitors' deaths are not included in the rate. And here's where we see the difference between population rates and population rate by DOH race ethnicity. For population rates, the denominator is based in population estimates from the US Census. These include estimates for the population by age and sex. For the DOH race ethnicity rates, the denominator is based on a special 5-year aggregate report that's created for HHDW by the census using the Office of Health Status Monitoring race ethnicity algorithm. We have obtained these special aggregate reports beginning in 2010. So when you look at the death rates by DOH race ethnicity, you'll notice that they're only available from 2010 forward. To give you an idea of what the rules that we follow for ethnicity, this is the Office of Health Status Monitoring race ethnicity algorithm. Because the death certificate allows up to 4 race ethnicities to be captured, there must be a set of rules in place for coding to a single race ethnicity. Here are those rules for deaths that list more than one race ethnicity. Essentially, if Hawaiian is listed in any of the options, then Hawaiian is coded. If a non-white race ethnicity is listed with white, the non-white option is coded. And then the last 2 rules basically state that if more than one non-white race ethnicity is listed, the first one is coded. And if more than one white race ethnicity is coded, again, the first one is coded. The categories included in the DOH race ethnicity algorithm include these 10 options. And given the diversity of the population of Hawaii, it's important to be able to explore data by these more granular race and ethnicity options. Let's head to the website. So here you can see we're at the HHDW homepage. You can easily go to our sister site, Hawaii Health Matters. And if you're experienced with this site, you can go ahead and go to build your own report. There's also some information and some videos to help you use the site in case you come back later and have questions. And then we also have our news and announcements. And this is where you can register for the coffee break. And then our featured content and our Instagram feed. Okay, but we're interested in the data. So let's take a look at the death data. What happens when you select the death data is you get to the death data landing page. So this gives a little bit of overview about how the data are collected. It talks about that the ICD-10 codes and also shows you where you can get state and national data from CDC. There's also data release notes that are helpful every year that we upload data. If there are changes or new indicators, we make sure that we note that in the data release notes. And then for death data, there's special topics too, because the death data also includes fetal death data, which would be miscarriages, and induced termination of pregnancy, which would be abortions. We do have data for those here. They are set reports, so you can't query them like you can for regular deaths, but the data is there. So the next thing we see is the number of deaths per year. And then below here, you can see we have our leading cause of death reports. So these are a great set of reports showing leading cause of death by race, ethnicity, age. They're very helpful. Okay, but we want to build a custom death report. So here we have the health indicator selection page. And you'll see that this is the data release notes, and this will send you to the most recent coffee break webinar. And then we have our death queries. Let's start with counts. So what we're seeing here is the default query result page. What this shows you is what you're looking at. So this is all deaths occurring in Hawaii, the date that you're looking at, and the default always gives you the 3 most recent years of data. And then it tells you if you've got the data grouped by anything. We are looking at it by year. So here you can see a chart. You can hover over the bars to get the exact numbers, or you can scroll down to the data table. This data table can be exported to Excel if you want to run your own visualizations on it. And below these are a quick way to go to other areas of the site, navigate the site, and then below that are our technical notes. So again, we've got some information about the data, about the suppression criteria. We have a suggested citation. So if you wanted to use any of this data in reports, you could use that suggested citation. But for those of you who know the system, you know that the power of it really lies in this ability to modify the query. So this is our query builder page. And don't let it overwhelm you. There are a lot of steps, but the majority of these steps are actually filters. So if you wanted to say only look at males, you could choose that here, and it will filter the data to show you only males. This is also where we pick the cause of death. So you can filter the data by the cause of death, geography, time period, and then we have some selected demographic characteristics. Step 7 is where you want to pay the most attention, because this is where you tell the system how you want to see the data. So instead of looking at it by year, let's look at it by race ethnicity. So now you can see we're looking at all deaths occurring in Hawaii from 2021 to 2023 by the DOH race ethnicity. And you can see there are definitely some differences. In the data table, you can sort these values ascending or descending. So this helps you see a little bit more clearly what the trend is. And then again, we've got our data and our technical notes below that. But we can actually go a step further. So let me show you. With this system on HHDW, you can look at 2 different dimensions at the same time. So let's just put sex in here and see what this looks like. And now we're seeing the number of deaths by race, ethnicity, and sex. So you can see where there's differences. Males are higher than females. And if you wanted to only look at, say, females, you can click here and it will take away the male data, or vice versa. And then again, we have our data table. These are all stable. Let's take a look at those rates. So we're back here at the health indicator selection page. We checked out counts. Let's look at rates, and we'll look at the crude rate. And here, again, we have the 3 most recent years of data for the states. So you can see this is deaths per 100,000 population. The rate is here, as well as the lower and upper confidence intervals, the number of deaths that it represents, and the population count. With the death rates, we can do the same thing as with the count. So we can modify this query. So in this example, let's look at a specific cause of death. And I'm going to be interested in Alzheimer's disease. So now the data will be filtered to only deaths by Alzheimer's disease. And I want to see how it's changed. So I'm going to go ahead and highlight all of these years of data. And we're going to look at the data by year. One thing you can do, you can change the chart depending on how you prefer to visualize the data. In this case, I'm going to use a line with error bars. And now we can see the death rate due to Alzheimer's disease in the state from 2000 to 2023. And you can see it definitely is rising. Let's take a look next at the age-adjusted death rates. So these should be very similar to the crude rates. The age-adjusted death rates take into account the distribution, the age distribution of the population. So if you want to compare Hawaii to, say, Florida, you would want to use the age-adjusted rates because the age distribution in the state is different. Okay, here again, we have our default query, which shows the 3 most recent years of data. And again, let's modify this query. So let's look at a different cause of death this time. Let's look at diabetes. And for this, we want to look at the counties. So what we're going to do down here now, instead of looking at it by year, we want to look at it by geography. And now we can see the death rate due to diabetes across the 4 different counties for the years 2021 to 2023. If you wanted to sort, so you could get a better visualization of the data, you can do that. Of course, you can hover over the bars to get the data values or go to the data table. The other nice thing that you get when you're looking at data by geography is this map. So what it does is it ranks the death rate from lowest to highest and uses a color scheme to show you where the highest and lowest death rates are. So this is a handy extra tool that comes up when you are looking at data by geography. All right, let's take a look real quick at the last set of rates, which would be the population rates by DOH race ethnicity. We'll look at the age-adjusted rates. Here again, we've got our default report. This time, it is showing the data by race ethnicity. So here is a great place to sort the data so that you can see the differences across race ethnicity of the death rate. And this is, again, for all deaths right now. Let's take a look at death rates due to COVID. And it actually has been added to the bottom of the list here. But there you can see we have our COVID deaths. And now we will see the death rates due to COVID. And again, you can see, as we've been alarmed about, the rate in our Pacific Island population is higher. And then here also the data. There are some data that were suppressed because sample size was too small, but you can always add more years to your search, and that will help increase your sample size. Now I want to give you some time for hands-on work. So take a few minutes to explore the 2023 death record data in hhdw.org and answer these questions. All right, let's take a look at the answers, but let's go ahead and see how we can get to these data. So the first question asks, how many COVID deaths were there in Hawaii in 2023? So this is asking for a count. We'll go to our counts query. We're going to modify the query. It's looking for deaths due to COVID-19, which, as we saw, is here. And it's interested in the year 2023. So we'll restrict this. Remember, the default report gives you the 3 most recent years of data. So if you want to see just the 1 most recent year, you can select that here in step 3. Okay, so let's take a look. And we can see that there were 170 deaths. We could also, if you wanted to have a comparison, you could add some more years in here and display it by year. And then you get an idea of what 170 means in relation to other time periods. Okay, the next question, which county had the highest age-adjusted death rate due to accidents or unintentional injuries among residents from 2021 to 2023? So we're interested in the age-adjusted death rate. We're going to modify it so that we're looking at deaths due to accidents or unintentional injuries. And then we want to see the data by county. So we'll tell the system here again that we want to see the data by geography. And now it will give us our death rates for COVID-19 based on counties. So we can see that Maui County had the highest age-adjusted death rate at 56.8. All right, the last question uses the DOH race ethnicity query, and it's asking which group had the highest age-adjusted death rate due to cancer for 2021 to 2023. So here we go to the age-adjusted death rates. Again, we're going to modify this query. We're going to start with the cause of death, and we're interested in cancer, which is also known as malignant neoplasms. And let's see how the data looks here. So now we can see the differences in cancer death rate based on race ethnicity. Again, we have the data table here. So the highest age-adjusted death rate due to cancer was again in our other Pacific Islanders. Wonderful. Thank you so much for joining us today. If you have questions, please feel free to email us and enjoy your day.